Okay, here we go. This is 2017 Anesthesia. This is Chapter 10 in our textbook. Let's talk about some of the notes that I have here. I'm hoping that I have this close enough that you can kind of see, so as I talk, you can be jotting these down. All of these are anesthesia modifiers. Some of them have to do with who's administering the anesthesia. Some of them are having to do with who's supervising for the anesthesia. Some of them are your MAC. Sorry. And here is your equation to code for or to determine the reimbursement for your anesthesia. It would be your base units plus your time plus your modifying factors or your modifying circumstances times the conversion factor. And then I have just some regular number modifiers here. So we'll talk about all these in a minute. I have opened up, of course you have your table of contents. I'm opened up to the green pages. Time reporting, this tells you when your anesthesia begins and when it ends. Any supplied materials, your separate procedures and your multiple procedures, the need for a special report. This is the very same as what we did in E&M. And then you have, if you take out all my notes, you have a heading that says anesthesia modifiers. That's your physical status modifiers. We'll talk about those in a minute. Your qualifying circumstances. And then here's some additional modifiers. I put them in here so that it's easier for me to pick out what I need instead of having to go to the HCPCS. It's just kind of like one-stop shopping. And the easier that I can make my coding, the better, I think, for me. And then these are some of the number modifiers that are all on your front cover. All of them are there. I just kind of brought them here because they're typically, if you're going to use a modifier, these might be the number modifiers that you would use. Okay, so overarchingly, what is anesthesia? The codes that are in here, if you just look at a random page in here, they all start with 0. So at a glance, you know that any code, 5-digit number code that starts with a 0 is anesthesia. It's the only codes that do that. Don't get it confused with any HCPCS or diagnosis codes that might start with a 0 or the letter O, but these are your CPT anesthesia codes. When would you code these? We know that every major procedure and most every minor procedure all have anesthesia attached to them. So you only code these anesthesia codes when you as the coder are responsible for the reimbursement of the anesthesiologist or nurse anesthetist. So if you're reading a surgery op report and they're taking out a liver or they're, fixing a fracture or whatever, and they say patient was sedated with general anesthesia and blah, 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 blah. You, in that instance, are coding for the surgeon, that physician. You only code I'm so sorry. You only code anesthesia when you are coding for the anesthesiologist or the nurse anesthetist. That gets very, very, very confusing to people. You would never, I put in a throat lozenge, so hopefully I'm good. You would never code anesthesia and the surgery code on the same time, at the same time, unless you wore 2 hats for your facility or something. And then you would code anesthesia and then code the surgery. Typically, that never happens. You either code anesthesia or you code the procedures. So for every anesthesia code you have in here, you're going to have a physical status modifier, P1, P2, P3, P4, P5, P6. So if your patient is going in to get a nose job and they were healthy going into surgery, they're a P1. If they had a gallbladder attack and they're going in to have their gallbladder removed, before that gallbladder attack, they were perfectly healthy, so they're a P1. That's how you assign these. P2, patient with a mild systemic disease. So patient may have hypertension, but it's very well controlled. P3, patient with severe systemic disease. Patient has diabetes and it's questionable if it's controlled or not. Patient has coronary artery disease and they've had 2 heart attacks. They have hyperlipidemia. They have all these other things. That's not just a mild systemic disease. P4, patient with severe systemic disease that is a constant threat to life. This would be your brittle diabetics that at any given moment their blood sugars are out of whack. This could be the person with severe COPD that's on oxygen all of the time, cannot go without any kind of oxygen. P5, patient who is not expected to survive. So without the surgery. So this could be one of your Grey's Anatomy scenarios. Patient comes in and has broke their femur, and you see their femur bone sticking up through the skin and they're bleeding out. That patient will not survive without surgery. So that would be a P5. P6, patient's already brain dead. They're just harvesting the organs. Okay. In the real world, your anesthesiologist will assign these. You do have to have a working knowledge of them for the purpose of the board. Probably what you'll see on the board, you might see a P6, which is easy because they're brain dead and your documentation would tell you that. Or you're going to probably see a P1, 2, or 3. That's usually what we see on the board. Okay, qualifying circumstances. These are add-on codes that piggyback or add on to any of these 0 codes. These are all standalone codes. So it has a plus by it, so it's piggybacks on the anesthesia code. So this 99100 is for patients of extreme age, either younger than 1 or older than 70. That one's easy to do. The next add-on, anesthesia complicated by utilization of total body hypothermia. This is for the patient who's going into surgery and they have to bring the patient's body temperature down to a very, very, very low temperature. Example, a coronary artery bypass graft or valve disease, any of the open hearts, they cool the body down really, really far. So that would be a modifier. 99135, this is anesthesia complicated by controlled hypotension, utilization of controlled hypotension. So this is someone who has to have an extremely low blood pressure in order to do the surgery. And then 99140 is any anesthesia complicated by the emergency conditions. So for that femur, that P4, that femur that was sticking out and they were bleeding out and we said that they were a P4, that was probably a very emergency condition to get them into surgery. So you would probably use a P4 or a P5 with a 99140. Now, for every code that you use in anesthesia, and we'll go through these in just a minute, for every code you use, you have a physical status modifier. Every code, you have a qualifying circumstance if these apply, And then for every anesthesia code, along with every anesthesia code having a physical status modifier, you will have a modifier that tells us who actually administered the anesthesia. So AA means the anesthesiologist administered the anesthesia. He did it, or she, himself, herself. AD is the anesthesiologist is medically supervising more than 4 anesthesia cases at a time. That means that there's an anesthesiologist there, and there's maybe 4 nurse anesthetists who are providing services, providing anesthesia to 4 patients at the same time, greater than 4 concurrently. QK, I skipped the G8 and G9. We'll get those in a minute. QK, medically directed, so this is the nurse anesthetist. Oh no, this is the anesthesiologist who is medically directing 2, 3, or 4 cases at the same time. So this one's greater than 4. AD is greater than 4. QK is 2, 3, or 4 at the same time. QY, all these that I'm giving you are for the anesthesiologist. Probably next time I write that in there, I may put them, the anesthesiologist and the CRNA. So if you're smart, you'll probably divide it up how I'm doing it right now, because that would have been much smarter. QY, medical direction of 1 CRNA. So we have AA, anesthesiologist is administering themselves. AD, greater than 4 at the same time. QK, 2, 3, or 4 at the same time. And QY, only 1 CRNA at the same time. Or only 1 CRNA is being medically directed. Now, for the CRNA, you have a QX, CRNA with medical direction. So that means they are being medically directed. Or QZ, CRNA without medical direction. They are providing the anesthesia without any kind of medical supervision. QS is MAC or MAC, monitored anesthesia care. And then G8 is MAC on a complex case. G9 is MAC, monitored anesthesia care, in a severe cardiopulmonary, specifically cardiopulmonary. And I think you do have all these. Let me look real fast. On page 414 of your textbook, it does talk about your monitored anesthesia care. And I don't know if they pull in. Yes, they do. On page 429, they talk about your HCPCS modifiers here. So you'll see all of those. So everything we just covered is in your textbook. I just kind of made it concise in here. Okay, now let's talk just very, very fast about this equation. I write it in here because you typically have at least 1 question on the board specific to this equation. So the B stands for base units. If you are an anesthesia coder, you have some little reference that will tell you for this particular procedure, it's worth 4 base units, whatever it is. You'll have some type of reference that will give you the base units. Time, here's your time reporting. Usually time is recorded in 15-minute increments, so there's 4 units in an hour based on a 15-minute increment. So if your procedure lasted an hour, or the time reporting from the beginning to the end of anesthesia was an hour, then this would be 4. Your modifying circumstances or factors. Again, you will have some type of reference to go to plug that in. And your conversion factor is based geographically where you are. Your conversion factor is higher in Manhattan than it is in Oklahoma City, simply because the cost of living is higher there. Here in Florida, you probably get a bigger conversion factor than in North Carolina. So that's how that all plays in together. So now let's actually look at the codes. Remember, anesthesia codes are only coded when you as the coder are having to code anesthesia for the anesthesiologist or the CRNA. These are not for the surgeon. So if you are reading an op report and see that the patient's under general anesthesia, you do not code that unless you've been instructed to code only the anesthesia. You wouldn't put anesthesia and the procedure on the same claim form, typically. Okay, head. This is for physician-based, remember. Okay, so anesthesia starts at the very top of the body. So think about the top of the body. You've got your head. So anything that has anything to do with the head is going to be under this. So this is going to be nasal stuff. This is going to be oral stuff. Your tympanotomy, another word for that is myringotomy. If you want to write that in, that's fine. So anything that has to do with the head. These codes are very, very general compared to the entire rest of the book. These are very general. Thorax, this includes the chest wall and the shoulder. So code 00400. This is anesthesia for procedures on the integumentary system of the extremities, anterior trunk, and perineum. So a shoulder could be included in this, but this is for skin, integumentary. So this is skin stuff. Okay, just kind of really intrathoracic. So this is inside the chest. This is where your open hearts will be. Lung stuff's in here. Heart, anything heart's in here. Something to think about when you look at code 00560 and 00561. One is without the pump oxygenator. One is with the pump oxygenator. Another word, anesthesiologists call it this. We'll see it in our op reports as a heart-lung bypass or a bypass pump. That's what we'll see it as. So you may want to write out here, i.e. also heart-lung pump, heart bypass pump, something like that. But that's what the terminology interchanges. Then we go into our spine and spinal cord. Upper abdomen, lower abdomen. So these are just very general areas of the body. We're still going down the body. Perineum, this is your privates. Divided male and female. Your vaginal procedures are in here too. Pelvis except the hip. Upper leg except the knee. So upper leg's where you're going to find the hip. The hip was not here, so the hip will be in the upper leg. Here's the knee and popliteal area. Popliteal is behind the knee. This is below the leg. Here's your shoulder and armpit or axilla. These are not skin. These would be your muscles, your joints, your tendons, that type of stuff. More in depth than just the skin. We saw the skin earlier. Upper arm and elbow, forearm and wrist. Then we have some radiological, just kind of generic codes. Any burn codes, if they were providing anesthesia for any of these burn procedures. We have obstetric. This is where your C-section can be, that kind of anything obstetric. And then other procedures is here. Everything ends in your unlisted, and with unlisted, we need a special report. Okay, so this is anesthesia in a nutshell. It's not too hard. Enjoy how general all of these codes are. because the entire rest of the book is as specific as you can get. Very, very, very specific. So enjoy this being so general. Okay, so from here, I think we go into skin.